treatment, and I think the most important thing will be prevention. If you have time, you have done a lot of details. I'm going to just go on the subject. I know you have a lot of information. I think the most important thing will be our discussion when we are just doing the question and answer to clarify those areas which we want to know. So we all know what cancer is, that it is a condition which is created by abnormally growing cells in the body that invade other normal cells, and that's how it causes disease, that's how it causes problems. Now, this particular cancer of the cells is caused by a virus. The germ starts the whole process is a virus. And the virus is called a human papillomavirus. We abbreviate it as HPV. There are very many types of this virus. In hundreds, you can talk about 200. But there are two major types that are associated with this cancer of the cells, and that is HPV 16 and 18. Now, this virus is sexually transmitted. So the disease affects women, but it's sexually transmitted, meaning their male partners have the virus, but they somehow survive the infection, so their partners survive cancer. But the male also suffer other diseases because of the same viruses, but it's not cervical cancer. They can get genital warts, they can get anal warts, they can get warts in the throat, and cancer associated with those areas. So, we are not going to go into the statistics. If you open the book and whatever, you find the figures there. We are not going that area. But we want to say that this cancer is the commonest cancer amongst women in our country, in Uganda. It has a rate of about 7,000 new cases every year and death of about 4,600 to 4,700 every year. Those are women. Now, how does one know they may be having cancer of the cells? That is the signs and symptoms. This virus enters the body and it enters the cells of the cell and starts causing changes. But these changes initially are not common. And actually from the type of infection up to when one develops cancer may take even up to 20 years. From the infection with the virus to when cancer can be diagnosed up to 20 years. But it causes changes that lead to that. So along that way, quite a number of things may happen. But the biggest challenge, and what is a very big problem, is that it shows no signs. Even the person who has a problem will not notice anything. And then unfortunately, most of our people in our society, most of us, we understand that it's a problem when we have pain, and it does not cause pain, even when it has become cancer in some other stages. So that's one of the challenges that we have. But when the disease now starts progressing and becomes real, then we start getting some fluids, which we call discharge, coming out of the lymphatic system that you notice in some fluid that keep coming. They are not good, they are not normal. They go to hospital. And unfortunately, some of us medical people may not be very alert. So that we now start suspecting what it could be. And we do RFP. We just start giving them medicine. We give them antibiotics. They take antibiotics. They think they will become better. A few weeks later, this year is back. And then now, some of the ladies start worrying with their husbands who are bringing infections from the other women, when actually cervix is beginning to get affected by cancer. So, our topic is Uganda, cervical cancer, Conandrum, solutions, and hope. It's a real phenomenon, mainly because it does not show signs and symptoms in the lifespan. And also because the society in general is not aware that there is this problem of cancer of the cervix. To the extent that even when you tell people that you have this and this and maybe pointing to it, they just deny it. They're going to deny it. And they keep away, they don't continue treatment. So that's where it's becoming a very big problem. It's claiming many of our ladies, our mothers, our sisters, our child. And it's happening when we could help ourselves. So how do we treat this problem? If someone is left to land in the place where the highest suspicious and they find out it could be. In the early stage, what we do, mainly, when someone already has signs, that means the disease is actually advanced. But it may be in early stages of the advanced section. We can do things like operation. When the cervix is affected, but a little bit of it, and the cancer is limited to the cervix, we can operate. We cut out that cervix, but obviously the cervix does not go alone. It goes with the uterus, it goes with the tubes, and some other associated so that we remove all the tissues that could be in line for the direct spread of this disease. And that disease can be eliminated by that operation if it is diagnosed early. I will give the treatment at that, and then we go at we look at now. If it's difficult to know, because it goes for pain, to really say anything, how do we help our ladies in order to be able to know there could be something brewing somewhere so that they prevent the occurrence of cervical cancer? So the most important thing is to prevent infection with the virus in the first place. So all these are messages that are packaged in the prevention of STIs or STDs. I'm not going to go into the details. But if we can prevent the other STDs, then we shall prevent the HPV. There are other germs that cause other STIs, then we can prevent HPV. Any person, every that has become sexually active should, or maybe I should use the word must, start doing cervical cancer screening. Any person, however young or old, whoever is sexually active must screen. Because it is known that most people, most sexually active people, acquire this human papillomavirus. The first benefit of it is that our bodies are immune competent and sometimes they fight and eliminate the virus. But there is that group where the virus persists and starts causing this process of growth. So this process is what we call the screening, should be able to pick out that cervix which is showing signs that there is presence of this virus and it's causing changes. And this can be accessed almost in most of our public health units. There is a test where we apply some acetic acid, it's like vinegar for the acid, and we just look by the eye, and you can tell there's a change on this side. And then the process can start to treat it. If it is seen at that early stage, they also be available even before operation, where we can remove those cells. Those who want to know the language with things like cryotherapy and others. So the most important is doing the test to see how is the state of my cervix. Is it a healthy cervix or it is showing changes? There is another test that is available, although it's a little more costly. It's called a pap smear, where we take cells from the surface of the cervix and we send them to laboratories. They go and stain them with them under the microscope and see are they normal or have changed. And then you can access treatment at that stage if they change. But most of all, we should actually be doing the HPV test itself, a laboratory test, which can be done by different methods. The most common swab from the private part, from the vaginal canal, and they tell you yes, you have HPV. And the process of monitoring now can begin. Now, what if I do those tests? I'm 25 years, and they tell me I'm negative. I can go ahead and access a vaccine that prevents infection. So there's a vaccine available, and actually the Ministry of Health, the government of Uganda, is trying to promote it. It's a bit costly. In real cost, if you go to pay for it, it's about 350,000 per dose. But it should be given to children who are between the age of 9 to 14. The assumption is that those children have not yet got sexually active, so they will not go through the virus. So you are giving them so they don't acquire the virus. But even if the person is older than that and is sexually active, if tested and found negative, this person can also benefit from the vaccine to help to prevent the infection. Overall, except that the young group, we need just 2 doses, while the older group, we need about 3 doses. We won't wait until the dose. So, I was rushing to reach this point so I don't get caught by time, but if I have a minute, I would like to say this disease, we say, does not cause discomfort initially. Just by discharge, then you reach a stage of bleeding. The first sign the lady is getting what we call contact bleeding. She has pointers and she realizes it's blood. Other times, she seems to be okay. But every time she draws, she sees some blood. That means she actually already has cancer of the cervix. Sometimes it causes discomfort in the process. The client should be more comfortable if her friend doesn't go into deeper. Those are some of the signs that that's already cancer established. Many times, nothing happens until the person goes past urine and sees the urine is red. There's blood in the urine. Others, they realize that whenever they go for the long haul, there's some blood that comes. But obviously now, these are late stages of the disease, meaning it has invaded the nearby structures, the structures near to the cervix. So, the other thing I would like to emphasize here is that near to the cervix. So, the other thing I would like to emphasize here is that once it's established as cancer, there is no treatment. All we do is to prevent further progress, to try and control the effects it's doing on the other organs, and give this person a relatively more comfortable life. But we know we are doing palliation. We are not treating to heal, but we are treating to give some bit of comfort as we prepare for the inevitable. So, we are talking about solutions. I want to emphasize it again. didn't go into details of the stages to go through, but I gave you the time that it can take so many years. Something can do that in that time to stop it. And then, if and when it has just that early detection is, those are some of the most important. There was something about the hope but we Cervical. I said, yes, we know that there's a deliberate move by the government of Uganda to Ministry of Health with partners to make available, make affordable this vaccine, to also have screening centers, government centers, where we can do early detection before we go into disease, and also get means of treating. We have the Uganda Cancer Institute. They are doing a lot in treatment, but they also have an arm in the prevention. But we still have challenges. There is general lack of information in our communities. The failure or the poor participation of the male partner into the process of the health of the ladies. Finances. We talk to the vaccine to the hospital, the transport to go to hospital, the perhaps we are paying for it, all those, they become barriers to these issues. So, but we know that there are campaigns which are going on. And actually, I think there's something like the Cervical Cancer Awareness Month, which is normally January every year. Yeah, there are so many campaigns that happen. There are so many different organizations and that's what participating in that. And we have hope that as the message spreads, as we become more aware, and as we come forward, screen, do tests, do other treatments, we shall have this monster tamed and controlled and reduced and stop killing